My fellow citizens of Doherty County, we continue to make strides in fighting the spread of the COVID-19 virus here in our community. But we need your help. If you or someone you know is eligible to receive the vaccine, as your county commission chairman, I'm asking you, please consider getting the vaccine. Together we can fight the spread here in Doherty County and make us happier, healthier, and stronger.
Good morning and welcome to our press briefing with updates on COVID-19. Please join me in a moment of silence for the lives we've lost due to COVID-19 and for the families they leave behind. Thank you. We will get started today with updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durham. Mr. Mayor.
We were informed the good news continues during this week's task force meeting. This report referred to a continued decline in the number of new cases, the positivity rate, and the weekly census at V.B. Putney. The public should, however, be aware that the virus is actively spreading, many residents are seriously ill, and COVID has taken the lives of another 16 Doherty County residents this month. I have two slides. This first we have news regarding the state's vaccination plan. Governor Kemp was in town this weekend to announce Albany had been selected as one of the state's 4 mass vaccination sites. The clinic, which will be operated by GEMA and Homeland Security, is located at the Georgia Forestry Commission, 1150 West Oak Ridge Drive. We're fortunate to have today Ms. Lisa Rodriguez-Presley from GEMA to provide details about the site. Most of you are presumably aware Governor Kemp held a press conference yesterday, during which he identified those individuals who will be eligible to take the vaccine in the next stage. All teachers and school employees, as well as adults with intellectual and developmental disabilities and their caregivers and the parents of children with complex medical conditions, will be eligible beginning March 8th. It is my understanding that the state will no longer follow the 1A, 1B, and 1C schedule which was previously adopted. Governor Kemp asserted this decision was motivated by the need to assure students are back in classrooms no later than the beginning of the 21-22 school year. The governor expressed confidence there will be sufficient vaccine available, though he acknowledged there have been some concerns about supply in recent weeks. Governor Kemp made reference to the recent approval of a third vaccine, which was developed by Johnson & Johnson, and increased production of Pfizer and Moderna vaccines in response to orders from the federal government. The objective of any vaccination program is population immunity, more commonly known as herd immunity. The percentage of the population which must be vaccinated to achieve this objective depends on the level of transmissibility of the subject disease. While some experts feel herd immunity to COVID-19 could be achieved by vaccinating 50% of the population, and others argue around 90% of the population must be vaccinated, the majority opinion is that the number is in the range of 70%. Governor Kemp stated that more than 800,000 citizens who are 65 and older, approximately 70% of the state's population, have been vaccinated. The Doherty County School System recently circulated a survey which asked employees whether they would be willing to be vaccinated. 65% of those who responded, almost 2/3, agreed to be vaccinated. I would like to commend the teachers and staff for their willingness to protect themselves and others. It is imperative that we understand herd immunity, if achieved, will not eliminate the virus. Rather, the spread of the disease is greatly impeded by the number of individuals who have immunity. Those who are not vaccinated would continue to be at risk, even if herd immunity is obtained. We should, therefore, encourage all friends and loved ones who are eligible to take advantage of the opportunity to be inoculated. Governor Kemp anticipates the state will expand the class of those eligible in late March, and observers continue to expect the vaccine will be offered to the general population in late April or sometime in May. I close by encouraging everyone to continue to wear a mask, watch your distance, and wash your hands. Thank you and good day.
Thank you, Mr. Mayor, for your comments today and updating our community. I would like to bring up now Doherty County Commission Chair, Mr. Christopher Cohenis. Mr. Chairman.
Thank you, Chief. Thank you, Mayor. Today marks, to me, a very special day where we are truly seeing tremendous progress in this community, and in a community where we have gone through so much, and we still are going through a tremendous amount. As the Mayor talked about, we're still losing lives, but we're actually starting to see some tremendous light at the end of the tunnel. And I want to first begin some of my comments by addressing, I think, certain misconceptions that I believe may have come out earlier in the week. I was contacted by a lot of people saying, why are we not utilizing this new mass vaccination site enough? Are we just not getting enough people out there and getting enough people vaccinated? And I want to dispel that rumor, because we were selected as one of 4 sites to be the host for a mass vaccination center. That is due in part, obviously, to our work and our collaboration with the governor's office. We're very thankful to the governor, very thankful to GEMA, very, very thankful to GEMA and to the governor's office for us to be able to receive this resource. We've worked very hard to be able to gain that. And initially there was some low volume at that site, but I want to address some of the reasons why. And that is because Doherty County has done such an outstanding job in getting people vaccinated. And as of last Friday, before the site was up and running, Phoebe Putney had already vaccinated about 31,500 people. Albany area primary health care had vaccinated, I think, about 5,500 people. The Department of Public Health had vaccinated several thousand as well. And literally, as I stand here today, Doherty County is in the top 5 most vaccinated counties in the entire state of Georgia. And that is a tremendous accomplishment, especially for a town of our size in comparison to the Gwinnett counties, the Fulton counties, the DeKalb counties, all of these other areas that have tremendous resources. We have worked and fought for tremendous resources here in our community in the wake of being number 3 in the world, in the wake of having to develop skill sets faster than anybody else, frankly, in the country, because we were hit so hard and we had to learn so fast. And this community has demonstrated one thing over and over and over again, that is that we are strong, we are resilient, and we are very self-reliant. And that has been from the bottom up, from the citizenry, as well as those working in the healthcare profession, as those being in the first responders, all the people that have come together. And I'm just standing here today, I'm very proud. I'm very proud to see the numbers that we're seeing, and seeing that we are within the top 5 most vaccinated counties in the entire state of Georgia, and that we've administered, as of right now in Doherty County, according to the Department of Public Health, 35,669 vaccinations. That is an astonishing number, and we are leading the way for many other communities to study. And I'm very proud that this community, in the wake of everything that it's been through, has been capable of having the strength, the fortitude, and the discipline and the diligence to be able to finish the drill and continue to work through the drill. The drill is not completely finished, and I've said again and again and again, this is not a sprint, it's a marathon, but we are truly stretching our legs in doing what we need to do, and I'm very thankful for that, and I'm very thankful to see the overall percentage decreased in terms of the rate of infection. We're seeing this in our numbers, and I said this several weeks ago. Like, we had several things that were happening. You had a bunch of people that got together during Thanksgiving and Christmas, and I can sit up here all day long and say, don't get together, don't get together, don't get together. But in reality, people are people, humans are humans, families are families. They're going to get together and they're going to connect. And we certainly wanted everyone to do that in a very safe way, but we also knew that there was going to be a spike, and there was, and it was a tremendous spike. It wasn't as bad as it was in March and April, but it did get scary for a while. And so that was like one train that was leaving on a track. And then secondarily, you had the vaccinations coming into the community, and eventually those two have collided, and we're starting to see not only our efforts from social distancing, from increased sanitation, from hand washing, from wearing masks, that working, but we're also starting to see the impact of vaccinations within our community, vaccinations that are having a real impact, vaccinations that are literally saving lives, vaccinations that have been administered to those that are over 65, those that are medically fragile, those that are healthcare workers, those that are taking care of people that are over 65 within their own homes and households. And so I say that to say this: it's really a hard thing to go through a lot of darkness and see what we saw in March and April of 2020. But we're starting to see the light at the end of the tunnel, and it is incredibly important for us to continue to embrace the resources that we have been given, that we've been fortunate enough to have, that God has provided us, and we really need to embrace those resources and do the right thing and continue to embrace the vaccine, to embrace truthful information. And I can't make anybody take the vaccine, and I can't tell anyone that they have to get the vaccine. What I can just do is humbly suggest here from this podium and in my interactions with people that consider the information, listen to reliable information, look at the numbers that we're seeing here in our community today. See the sharp decline that the mayor very, very well characterized, and that we're seeing in our hospitals, that we're seeing with our friends and our family members. And frankly, we are reducing the overall number of funerals that are the result of COVID-19 here in our community. And again, one is too many, but certainly you don't want that number to continue to multiply. And we have so many resources, frankly, that other communities don't have. And what I would love for everyone to imagine is Southwest Georgia, Albany, Doherty County, which is the hub of Southwest Georgia, continuing to lead the way after being faced with the worst of circumstances. in emerging from all of this darkness into the light before everyone else. I've talked about herd immunity, and I've listened to it from the doctors and from the medical staff, and we have an awesome opportunity to be able to achieve herd immunity before much of the rest of the country, and to actually live in an environment where we feel safer in the air that we breathe and the hugs that we give and the family members that we spend time with, and we don't have to have that nagging question constantly of, is this going to do this? Is this going to cause this? Am I going to harm this person? And we're not there yet. But herd immunity is something we should strive for, and we should continue to embrace these resources. I'm very thankful to the governor's office and to GEMA for us having this mass vaccination site, in addition to us having Phoebe Putney, in addition to us having the Department of Public Health, in addition to us having the Albany area primary health care, as well as the several other pharmaceutical providers that are here in the community providing the vaccine. This is something now, as we're getting towards the end of this marathon, we've saved some breath, and we need to stretch our legs and get as many people vaccinated as absolutely possible, because each time we reduce one person from the pool of people that are capable of transmitting the virus as a whole, if you view this community as a body, you're making this body healthier. And that reduces our overall vulnerability. It makes us better in terms of our health. It makes us better in terms of our mental health. It makes us better in terms of how we're able to conduct business. It reduces the impact on the countless businesses that have suffered tremendous losses because of all of the uncertainty and chaos that has ensued following this horrific pandemic. We have that as a resource, and I'm very thankful here. And I remember the days where I stood here and I didn't know if we would ever see a vaccine. And now we have a vaccine from multiple different providers. And it certainly, from my observation, and I'm not an epidemiologist, I'm not a doctor, but I do know numbers and I know common sense. And we are seeing a true positive impact here in our community. And again, our community is one of the top 5 most vaccinated counties in the state of Georgia, and I'm not going to be happy until we're number 1. Thank you.
Thank you, Mr. Chairman, for your comments today. I will pause for a moment. I've been encouraged to, as Emergency Management Director, to share my story of having had the vaccine. Before I bring Dr. Black up, Dr. Black has certainly shared his story with us. He's had both shots. He's completed the cycle, and so have I. And I want to encourage all of my family and friends, even my church family, Second Mount Zion, to get out and go and be vaccinated. I had the first shot. My arm, both shots in my right arm. My arm the first day was a little bit sore for a couple of days, but it went away. I went back, had the second shot. The second shot was even better than the first one. It did not, a little discomfort the first day. After that, it went away. I'd heard stories, people saying that they go back for the second shot and they get sick, they have fevers and all of those things. I did not experience that. It was a great experience, good staff, nice people over at Phoebe Putney. I went to Phoebe and went through the Pfizer vaccine, and it went well. And I just wanted to share that with you, share the story as your fire chief and emergency management director for this city and county. I want to encourage all of you, if you're in the phase, please consider going out and be vaccinated. If we ever want to reach that normal period again, that certainly is the way to get there. So I wanted to share that with you this morning with all family and friends. And now I want to bring up someone who has shared with us his story. Dr. James Black, who is the chairman of the emergency department at Phoebe Putnam Memorial Hospital, for some comments. Dr. Black.
Thank you, Chief, Mayor, Chairman Cohenis. Glad to be up here again in front of you this morning with a little bit of good and encouraging news. Our numbers this morning at Phoebe, we're caring for 51 COVID patients in our hospitals, 39 over at Phoebe and 12 in Sumter. Those numbers are sharply down from a couple of weeks ago, and we're seeing a continued decline. But the number is not zero, and we don't need to be complacent. We need to continue with those safe habits that have seen us time and time again respond to this pandemic in a favorable manner. So we'll take the good news, but we don't want to let our foot off the gas. And we do know that spring break is around the corner. And as we've seen after these holidays, our numbers tend to spike again. So again, be aware. We're going to continue to wear the mask, we're going to continue to avoid close contacts, and we certainly want to get as many people as we can vaccinated. And you've heard the chairman and the mayor both comment about how our processes have gone and how we ranked in the state. And as a testament to that, we get people from around the state and from other states calling in, coming, trying to get vaccinated here. And but we certainly want to be as helpful as we can. But we know that our priority are going to be the people in our service area, in our zip codes. So we haven't opened up the floodgates for everyone to come get it, but do realize that not a lot of people, not everyone around the state is as fortunate as we are in order to have vaccines available. Through yesterday, through Phoebe, I think we had administered over 33,000 vaccines to date. You heard the numbers from the other people who were getting vaccinated, and we received a good supply of additional vaccinations this week. As the state gets larger amounts, we're hoping that we're going to get larger amounts, and that our supply will become even more stable than it has been. And it puts us in a really good position in order to meet the demands of this part of the state. We're certainly excited by the governor's announcement yesterday that educators, school workers, adults with intellectual disabilities, and parents of children with serious health issues are going to be added to that list of people who are eligible to receive the vaccine. And I believe the eligibility begins on March the 8th. But you can go ahead and plan and schedule those appointments now through the Phoebe website, through our hotline, 229-312-1919. And we're certainly, as others have mentioned, extremely grateful to the state and GEMA. And then we have a mass vaccination site in Albany behind the Georgia Forestry Commission. It's off of Newton Road, for those of you who are unfamiliar with the location. And it's going to be very helpful as that category expands. It's going to help us meet the needs of the community. You can go to myvaccinegeorgia.com in order to schedule an appointment at that site. And we continue to provide vaccinations at our hospitals at Phoebe Main in Albany, and Phoebe Sumter in Americus, and Phoebe Worth in Sylvester, as well as 5 of our clinic sites, our primary care clinic sites, and that's at Phoebe Northwest, Laurel Place in Lee County, Sylvester, Camilla, and Buena Vista. Also planning many other pop-up vaccination events in some of our underserved areas. Again, we strongly encourage anyone who's eligible to receive the vaccine. My biggest testament is that I have encouraged my mother and my sisters also in healthcare to get the vaccination. And for those of you that have known me, there's no more people more important to me than those, and I would not advise them to do anything that, number one, I wouldn't do, and number two, something I think was not only extremely safe, but certainly very helpful. As the chief mentioned, I've had my vaccination. I was, I guess, the first in this area to get it, and I am 10 weeks out from my first vaccination and 7 out from my second, 7 weeks out. And I know that I've had a bunch of people unabashedly tell me they're going to wait and see if I'm still alive after I got my vaccination. So I'm here to tell you, to the dismay of some and probably disappointment of others, that I'm still alive and upright, and I have not had any side effects from it. I had a very mild soreness, and that was it. I do realize that some people have a little bit more serious symptoms, but we have not had anyone report symptoms. We only had a couple report longer than 24 hours, but most of them less than 24 hours, and self-limited, and they're back to normal. But I'm also here to tell you that we expect that when you get a vaccination, having those symptoms is a sign that your immune system is actually responding to the vaccination. So it's actually doing what it's supposed to do, doing what it expects. I didn't say that if you had no symptoms, it mean it didn't work. That's not the case at all. But we expect some people to show some signs after they get the vaccination. I do want to address a couple of the myths that we have had. And number one is, I'm afraid that I'm going to get coronavirus if I get the vaccine. There is no physical scientific way for you to get coronavirus from getting the vaccination. The vaccine does not contain coronavirus. Okay, it does not contain live viruses. There are some vaccines that do. This is not one of them. So you cannot get coronavirus from the vaccination. I know I've heard people tell me about microchips and nano things that they can put into the blood to track you, and I will tell anybody that if you're carrying a cell phone, you can't be worried about somebody tracking your whereabouts, okay? And if the technology exists, I don't even know if it does, I certainly wouldn't worry about it, but I don't think that's not the case. The vaccine does not contain that type of technology. Also heard about growing additional limbs and so forth. None of that has happened, all right? There have been no deaths that have been tied directly to getting a vaccination. But here in Southwest Georgia, I know we all know people or groups of people that have died from getting coronavirus. So the vaccine, which is shown to reduce the likelihood that you will get sick when you come into contact with somebody with coronavirus, and even if you do get the virus, it will lessen your length of time and also severity of symptoms. So there's a tremendous amount of upside from getting the vaccine with very little risk associated with it. So again, we're going to encourage and continue to encourage people to get the vaccination. I'd also like to tell you that the vaccine is not a be-all, end-all. Please do not walk out of getting your vaccine or getting your second shot and say, I'm free, I'm never going to wear a mask or wash my hands again. That is not the case. And I want us to consider the vaccine like wearing a seatbelt, okay? It's one of those things we do to remain safe while we drive. If you happen to get in a car wreck, wearing a seatbelt has been shown to increase your likelihood of survival and reduce your risk of injury. It's the same thing with the vaccine. Now, you can overcome that benefit if you have risky behavior. If you decide to wear your seatbelt and drive 130 miles down Pine Avenue and ignore the traffic signals while you're eating a sandwich and talking on your cell phone, if you get into a wreck, you're likely not to survive in spite of wearing your seatbelt. As such, even if you get vaccinated and you stop washing your hands and you start with other risky behavior, and we don't have to go through that again, you can still get coronavirus from it. So you can overcome the benefits of getting a vaccination. So again, the vaccine is just an additional part of our fight against the spread and the severity of this disease. So we strongly encourage everyone to get it. We will continue to update you. We're going to continue to be as transparent as we can, and we're going to continue to do everything we can for this part of the state. So I thank you for your cooperation thus far and your ongoing cooperation. Chief.
Okay, thank you, Dr. Black, for your comments today. We will now hear from the Department of Public Health, Dr. Charles Ruiz, who is Director of the Southwest Georgia District, for some comments. Dr. Ruiz. Stand by, Dr. Ruiz.
Good morning, everyone. Yes, there's good news. The numbers are going in the right direction, and that's great to celebrate. It's great to have hope, but it's certainly not time to say we can claim full victory, because we can't. We still need to do those things that we know are wise, and one of those things is getting a vaccine if you are eligible. And I want to say that the supply of the vaccine in Southwest Georgia is very good right now. We did go through a few days of limited supply, and that was not because of the manufacturing process or quality or anything like that. It was simply a weather event, and it interfered with the safe transportation of the vaccine. So the weather is better now. The vaccine is being transported, and we have a good supply here in Southwest Georgia, and as far as we can tell, that will continue to be the case, and we're hoping that the pharmaceutical industry will be able to manufacture the Pfizer and Moderna in larger quantities, and we're also hopeful that other pharmaceutical companies will be able to come on board. I believe today there is a very important meeting to take a look at the Johnson & Johnson product. So we're hopeful that that product will be available in the coming days. The eligibility is expanding, and it's already been mentioned. That will come into effect on Monday, March the 8th. So that's about 10 days from now. That will, of course, include the teachers. In Southwest Georgia, many of the school districts, if not all the school districts, already have plans for most of their staff. In many districts, public health will be involved in vaccinating teachers and supporting staff. In some situations, it's hospitals. I believe Albany area primary health care will be involved. The superintendents are doing a good job of seeing that there's a plan for teachers and the school staff to have access to those vaccines. So it's easy for those who are eligible to get an appointment to get a vaccine in Southwest Georgia. Generally, the waiting time is short. In many counties, you can get a vaccine if you're eligible within 24 hours. For public health, right now, there are two ways to schedule a vaccine appointment, and you do need an appointment. And one of the reasons is because we have to ensure that we have the vaccine and the staff to administer it, but we also have to ensure that we have the vaccine thawed out. And the Moderna vaccine that we're using comes in vials that include 10 doses. So we need to know how many are coming so we can get prepared. So one way to do that is to call our hotline at 229-352-6567. This number is functional from 8 a.m. to 4 p.m. Monday through Friday. You could also call your county health department and schedule an appointment. And we're pleased to say that in the next week or so, we will have an online option. The idea here is that this option will be available to make an appointment throughout the state of Georgia through public health. It is being more or less piloted right now, and when it's available, we will have a press release and let everyone know that it's available, and then you will be able to go online from any place you choose 24 hours a day and make an appointment for a vaccine for public health. I think you'll probably hear more about the GEMA mass vaccination site located at the Forestry Commission, and you enter it from Oak Ridge Drive. And so there are many people who have had COVID-19 testing done at this very site between July of 2020 and December of 2020. So it's the same place, it's the same entrance. Okay, so this is a list of the way the eligibility criteria will be as of March the 8th. It includes the current eligibility with the expansion. So currently, healthcare workers are eligible along with law enforcement, fire personnel, first responders, residents, and staff of long-term care facilities, individuals who are 65 years of age and older, and their caregivers. But those bullets below that, the teachers, the educators and staff, the adults with intellectual and developmental disabilities, and their caregivers, parents of children with complex medical conditions. Those last three are additions that will go into effect March the 8th. For public health, we will begin making those additional appointments, or we will begin making appointments for those additional categories this coming Monday. So the last thing that I want to talk about is a contrast between the upcoming weekend and the last time we had the last weekend in February. So we're looking at the last February of 2021 right now, and I think it's worthwhile looking back at the last weekend of 2020 and considering the differences, especially when it comes to COVID. It was the last weekend of 2020, of February of 2020, that COVID came into our community. Nobody, literally nobody, knew it for 10 to 14 days. So we were all more or less sitting ducks. We were all susceptible. We had no knowledge that it was among us. We had no way to fight back at that time. And even when it became clear to us that it was in the community, we were still limited in knowledge, we were limited in medical interventions, limited in our ability to even test for the disease. An awful lot has happened in the 12 months that have followed. Today, the last weekend in February of 2021, we have much more knowledge. We have much more of an option for medical interventions. We have choices now that we simply did not have 1 year ago. Today, if we choose to, we can protect ourselves and our loved ones in a variety of ways. Some of the ways are very simple. It boils down to what we do. We choose whether or not we will practice social distancing, wear masks where it's appropriate, and keep our hands clean and stay home when we're sick. It's our choice whether or not we will get a vaccine when we are included in the eligibility criteria. It really does, in many cases, boil down to a choice of life or death. The vaccine is free. It's available. Over 30 million Americans have taken it. There have been no deaths from it. And it is a part of human nature sometimes that when we form a strong opinion, we tend to dig our heels in. And even though we might be confronted with evidence that our opinion may not be right, it's hard to let go of a belief system that we've had for months and months and months. But we want to urge you to reconsider if you're one of those who is hesitant about vaccines, if you have not fully believed in the dangers of COVID, please reconsider, because the choice is life and death. And if you are willing to have an open mind, if you're willing to look around you at your friends and your neighbors who have had the vaccine with no significant side effects, please consider the possibility that it's time to embark on a new way of thinking. The vaccine is available. If you're eligible, please don't delay. Call today and make an appointment. Do what you can to protect yourself and to protect your community.
Thank you, Dr. Ruiz. I'd like to bring up now Doherty County Coroner, Mr. Michael Fowler, for some comments. Mr. Fowler.
Good morning. I'm going to give you a few stacks going. The mayor and the chairman and others have given their points of views of the virus and the positive things about it. Also, death rate has gone down compared to what it was. As of February the 26th, we have a total of 271 deaths reported to us. Since the last press conference, we was at 259. Now we're at 271. We have 12 more deaths from the last press conference. People are still definitely dying. From the point of the location of the death, 31721 have 40 deaths in that location. 31707, we have 54 deaths in that zone. On the east side, we have a total of 69 deaths, 31705. The South Albany has been hit the hardest. We have 108 deaths in 31701 location. We have 63 whites, 4 Latino, 3 Asian. We have 201 black, 201. It definitely hit the Afro-American community hard. The females, we have 142. Males, we have 129. So it definitely hitting the females more than they're doing the males. We have 104 black females. We have 97 black males. We have 28 white males, 35 white females, 2 Latino males, 2 Latino females, 2 Asian females, and 1 Asian male. The mid-range is still 60. We have 3 over 100 that have died from the virus. In the age of 90, we have 26. In the age of 80, we have 62. In the age of 70, we have 63. In the age of 60, we have 75. Age of 50, we have 20. Age of 40, 15. Age of 35. And the age of 20, we have 2. Looking back the last few months, back in October, we was doing great. We got down to 6. I know 1 death is still too many. We got down to 6 in October. November, we dropped down to 4. December, it picked up a little bit, maybe because of the holidays. We went up to 14. In January, after the holidays from the Christmas and the New Year's, we had 41 deaths in January. We had more than we had in March when we first started out. So as of February, we have a total of 16 deaths for this month. Again, like each one have said already, it's your choice, as Dr. Ruger said, whether or not you take the vaccine. My story, I've taken the vaccine. I've taken both shots. The first shot, I didn't know it looked like I had taken a shot. The second shot, I had a little soreness in the arm. Besides that, I mean, I've been feeling great. My wife had the shot, and I encourage, as the chief said earlier, I encourage my family, friends, church family, even my enemies, take the vaccine. You need to take the vaccine. Some kind of protection is better, none at all. But it's your choice. So you decide whether or not I take a chance of going to a hospital, being put on a ventilator, whether I have a choice of whether the coroner come to my house or come to my residence. But the safest way is to take the vaccine. As I said, I encourage each one of you to do that. And as Dr. Black said, I don't know anyone that have died from taking the vaccine. So please take the vaccine. Mask up, practice social distancing, wash your hands. Let's do what the science is say. Thank you.
Thank you, Coroner Fowler, for your comments today. We have today with us Lisa Rodriguez-Presley. She is the External Affairs Supervisor for the Department of Emergency Management and Homeland Security. We're very happy to have you with us today, and we'd like to bring you forward for some remarks. Ms. Rodriguez-Presley. Stand by just one moment.
Thank you. First, I'd like to thank the County Commission, Mayor, and Chairman Chris Cohenis for the opportunity and the invitation to be here today to discuss our mass vaccination sites. I'm honored to represent our agency and to share some of the details regarding the site here in Albany, as well as the other sites we're operating around the state. The team at GEMA HS has been working around the clock with our federal, state, and local partners to get these 4 mass vaccination sites prepared. This has been a monumental effort on the part of our agency, our staff, our partners, and in a relatively short period of time, we've been able to put together what is proving to be an efficient system for administrating vaccines on a larger scale. We are all in this fight against COVID-19 together. I can tell you, GEMA's done many different disasters. We have never expected to have to be doing vaccinations, but in looking at what was happening, we knew that we could do more to support the state's vaccination efforts by expanding capacity. So we leveraged the logistical knowledge that we have, and we kind of used that as a blueprint for developing these 4 sites. We've ensured that each one of them is self-sustaining with regards to vaccine storage, technology requirements, security, and staffing. We're using the Pfizer vaccine at all of our mass vaccination sites, which you may know requires the ultra-cold storage. And when I say ultra-cold, negative 81 degrees Celsius. So we've had to bring in special refrigeration in order to be able to store those vaccines on site, but that's going to allow us to administer more vaccines because we're able to keep that on site. The locations selected for these sites allow us to target some of the communities that have been especially hard hit by COVID-19, like Doherty County. Combined with infection rate data and community equity profiles, we determined that the 4 sites we currently have in place were the best locations to start. There is a likelihood that we will be expanding the number of sites across the state as allocations of vaccines from the federal government increase. As you may be aware, there is a 3rd vaccine that is currently undergoing the approvals process, so we expect to see more availability in the near future. What we would ask as an agency is that you support this effort by getting the word out that this resource is here, not just for the people of Doherty County, but for all of Southwest Georgia. Often word of mouth advertising is the best kind, so please share with your neighbors that these vaccines are here and that they are available at this site. If you would go to the next slide, please. So the current capacity at the site is 1,100 vaccinations per day. And when people are pre-registering on the site, and the site is myvaccinegeorgia.com, we're finding that we can get them through the process in about 6 minutes from the time that they get there and show their QR code until the time they're completed. So the pre-registration, though, is key. As of today, the site here in Albany will no longer be taking the drive-ups that we had been, and we had never planned on taking drive-ups. We had always planned on it to be a appointment-only site. However, you know, in the beginning days, I think we saw a little lack of participation, so we decided to open it up, and we've been seeing dramatic increases in the number of people who have been coming to the site to get the vaccinations. Today, as a matter of fact, we have the highest number of registered people coming to the site today. We have 1,021 people registered to get vaccinations today, so that's been a tremendous increase over Monday. If you are having difficulty, and we realize that some folks may be a little technologically challenged, and you may need some assistance getting an appointment set up. For the Albany site, these numbers are site-specific. For the Albany site, you can call 844-275-3428. And we also wanted to make sure that people were aware that for our deaf and hard of hearing community members, there are ASL interpreters on each of these sites on Tuesdays and Thursdays. So if you schedule your appointment for Tuesday or Thursday, we can make sure that you have access to an ASL interpreter to walk you through the process. Next slide, please. So I know they've alluded to the change in the vaccine, basically what makes you eligible for a vaccine that's going to be effective on March the 8th. And so adults with intellectual and developmental disabilities and their caregivers, parents of children with complex medical conditions, and we do not have a list of those medical conditions. So at this point, we're saying, you know, if you have a child that has some sort of complex medical condition, until we're directed otherwise, and you qualify for a vaccination. Also, pre-K, K through 12, and Georgia Department of Early Care and Learning licensed or exempt child care programs, educators, and staff will be eligible as of the 8th of March. If you would go to the next slide, please. So this is these are the vaccination stats for all 4 of our sites. As you can see, you looked, Monday was the lowest number with 50 people. Yesterday we were at 546. Today we'll be over 1,000. So the word is getting out, and again, we encourage everyone to please spread the word to your neighbors that this site is here. We also encourage you to utilize those other resources that you have in your community, your Department of Public Health, the people at Phoebe Putney. They've all done just a phenomenal job with the vaccination, and so we're here to supplement those efforts. Thank you.
Thank you, Ms. Rodriguez-Presley, for your update today. We're very appreciative to have the site here and have you with us today. We'll pause now for any questions. Please. Okay. Okay. Okay, I'm going to ask Dr. Ruiz to come up. The question is, please provide a definition of caretaker. Ask Dr. Ruiz to come up and address that.
That's a very good question. When we're talking about caretakers, we're talking about someone who provides direct assistance to another person that puts them in close proximity to them. So if, for instance, if I go and help someone with a yard service and they remain indoors, then that wouldn't be included. That doesn't create any kind of risk for anyone. So we're generally talking about things like someone who goes into the home of another person to provide assistance with activities of daily living, such as bathing, food service, assistance in getting someone to a doctor's appointment and those kind of things. If you're in close proximity to someone on a recurring basis, we generally accept that as providing care. And as far as vouching for that or having some sort of evidence, we're basically going by the honor system. We do expect anyone who claims to be a caretaker to explain to us what service they provide, what relationship they have to the recipient, whether it's professional or family or friend, and just a little bit in general layman's terms about the reason why the assistance is needed. Just for instance, if someone is weak or bedbound or something of that nature. So we're asking the public to cooperate with us and be honest, be genuine. It's basically an honor system for public health.
Okay. Thank you, Dr. Ruiz. Any other comments, Ms. Howell? Questions? Any? Okay, great. This will bring our press conference to an end today. We will be back on March 12th, as we are now meeting, having press briefings every other week. So we will not be here next week, but we will be on March 12th, and we'll look forward to seeing you then. Thank you, and have a great day.
We need your help in continuing to fight the spread of COVID-19. If you are eligible to receive the COVID vaccine, I encourage you to do so. If you have family members or loved ones who are eligible, I would ask that you encourage them to be vaccinated. You and they, in doing so, will protect yourselves, your family, your friends, your co-workers, and our community.